The government has announced changes to social care, including money for disabled people to improve their homes and support for care workers to take on further duties.
But any major reform has been pushed back until 2028. Well, the Health Secretary, Wes Streeting, joins us now from a care home in Carlisle. So you're launching this official inquiry. Some results will be gained by 26, some by 28. When will we actually see reform, though, Health Secretary? Because, as you know, as I'm sure you know from the care home where you're there, there's a recruitment crisis. There is a terrible lack of underfunding, and people need help now.
Yeah, that's absolutely right, Kate, and Happy New Year. Reform is already underway. Within the first 100 days of this government, we legislated in our employment rights bill for the first ever fair pay agreements for care workers so that we can tackle that recruitment crisis and build the care profession we need. We've delivered the biggest expansion of carers allowance since the 1970s to help family carers. And we've also, through the budget, increased significantly the spending power of local councils, including £880 million specifically ring-fenced for social care. And today we're announcing that not only will the disabled facilities grant increase by £86 million from April for the next financial year, we're actually releasing that same amount of uplift, £86 million, this month, which will mean that between now and April, we can deliver around 7,800 home adaptations for disabled people to help keep them more independent, more active, and crucially to keep them out of hospital too. There'll be more to come, and you mentioned with the commission we're setting up that its first report will be next year to set out a plan for this Parliament about the further reform we can do to lay the foundation for a national care service. But the reason this commission is so important is that if I think back over the last 20 years or more, under Labour, Conservative, Lib Dem and SNP-led governments across the country, what we've seen is a failure of politics. There's not a shortage of good ideas, but there's a shortage of good politics. And that's why we've asked one of government's best-known social reformers and doers, Louise Casey, Baroness Casey, who is a crossbench peer, so she's not affiliated to any party, to lead this work, to set out what I hope will be a national consensus to build a national care service. We're having cross-party talks next month, and we'll want to involve the whole country in a national conversation about what social care needs to look like to help older and disabled people, how we should deliver it, and how we should fund it. And I hope by doing it that way, we can break the short-termist cycle of bad politics, which has let people down on social care time and time again.
We know what you mean, because it's a tough one, isn't it? And as you rightly say, successive governments of all political parties have failed to deliver on it. It's going to feel to people living with the crisis in the moment, though, like it's being kicked down the road. Because what do you really mean by we need a consensus in politics? You've got an enormous majority, Labour has. You had it in your manifesto that you wanted a national care service. You first started talking about it in 2009. What are you going to learn that actually means... you saying you need the Lib Dems and the Conservatives to make this happen? Where are the ideas to embark on now?
So I think what I would say to gently push back on that criticism is that sort of mentality has led to the kind of failure I was describing earlier, where effectively general elections
Why has it, when you had the majority to get it through? Do you not know the ideas? Look, I'm going to be honest, in my mind, I'm thinking about the situation with Derek. It actually happens to be the anniversary of his death, one-year anniversary of his death today, which is a day only relevant to me. But over the last few weeks, you know, the family and I have been talking about the challenges we faced this time last year. And one of the overriding ones, till he went back into intensive care before he passed away, was dealing with the funding of care. At the time of his death, there were 2 appeals that hadn't been heard for funding. It kept on getting pushed back and pushed back. In the meantime, and I'm lucky, I've got an incredible job, which is well paid, I was having to fund the situation. Now, I've got excessive unpayable debt because of it. And if I'm in that position, what else are people going to be? People can't afford 4 more years of this.
Yeah, and Firstly, Kate, and I know lots of viewers will feel the same having followed, I think that's why the anniversary you're going through, yourself and your family, which all of us are with you with totally heart,
and I know you feel it too.
On that.
I only mention it because I'm aware that there are people that are in the situation that just don't have that time.
Yeah, I was going to say, Kate, I think that's why your story connected with so many people. It's not just that you're a familiar face on people's screens and your viewers feel they've got a relationship with you as a presenter. It's also because your experience with Derek and your family's experience resonates with so many people across the country who are struggling with the same costs or the same unmet needs or similar experiences. And I think one of the reasons why we've ended always back into this sort of the short-termist cycle of failure is whenever we talk about social care, there are costs involved, and that sort of makes people run for the hills and want to stick their head in the sands in politics because sometimes those numbers can be scary. And one of the reasons I genuinely think, even with the majority of the size that we've got, it's a good thing to try and build cross-party consensus, is I want to come up with a plan that means whoever's in government after the next general election or the one after that, whether it's a Labour government or a Conservative government or a coalition or whoever, that broadly speaking, we keep the same direction of travel on social care in the way that we have with the NHS since 1948. Because that, for me, has been one of the successes of the NHS politically. It's great that it's there for everyone, but it's also the politics. Absolutely. I want to do this properly. It's eluded us for decades. We've got to do something differently. And that's why I hope this will be a triumph of hope over experience on social care, frankly. I'm excited about this commission and its potential. It's got good cross-party support already. I'm encouraged by some of the noises I'm hearing from other parties. So I do think there's an opportunity here for our country.
But Wes Streeting, there are immediate issues that a lot of people at home will think, well, why can't they be solved now? They are in lots of other industries. Now, at the moment, we know there are 131 vacancies across adult social care. 131,000, I should say.
131,000, yeah.
And that can be solved right now. You don't need a commission to tell us in 4 years' time that you've identified that. Why can't those vacancies be filled right now?
Yeah, so that's the reassurance I definitely want to give to your viewers this morning. We are going to be taking action. In fact, we've already started taking action since the general election to deal absolutely with the crisis that's staring us in the face. And I want to stabilise the social care sector. That's why we legislated within 100 days for the first ever fair pay agreement so we can start tackling that crisis in recruitment and retention. It's why the measures the Chancellor took in the budget to get funding into social care has been really important.
I'm just a bit worried that we're going to run out of time, so let me just get into that. Workers' unions for the care workers are saying that they need £15 an hour minimum. Would you support £15 an hour for care work, which we know it's not easy work, it's a tough job, and if we want to recruit good people, they need to be paid well. Would you support £15 an hour?
Well, we definitely want to see the floor of wages and social care rise. That's why we're getting this legislation through Parliament. We'll be negotiating with employers, trade unions, local government to get to that position of increasing not just the pay, but the professional recognition of care workers.
Is too much to pay a care worker? I mean, this is the issue, isn't it? It's such an important job, and we're trying to get people there. It's very simple. I mean, at the moment, I mean, what is it, £12 an hour? Would you work for £12 an hour as a care worker, Mr. Streeting?
Well, I do think care workers deserve more. I'll tell you why it's not quite as simple as you've just suggested, because obviously, when it comes to increasing wages, we do need to find the money. And all I'd just say to people is that in the last 6 months, we've taken some big decisions as a government, and sometimes unpopular decisions. If I think back to the budget and some of the decisions we've taken, they've not all been popular. The reason we've taken those decisions, knowing they'd be unpopular, is we know we need to take those decisions to get the country out of the massive hole it's been left in. And that is going to take time. I'd love to be able to go faster, and I wish I could be here this morning saying, don't worry, folks, £15 an hour coming in for social care tomorrow. But I've got to get to a place where we can fund an increase in wages and we can tackle the crisis. It does take time, and I'm just saying the government's only been in for 6 months. Give us a chance, but we know this is a problem. That's why fair pay agreements was within the first 100 days.
We see pay rises rises are given to, you know, railway staff. Those decisions can be made. There's no reasons why they can't be done. But just on the vacancies, we know that visas are down from foreign workers coming to work in the migrant scheme. Would you not support encouraging them to come back and fill those jobs? A lot of them were filling those jobs, but the previous government has not allowed their families to come with them. Do Labour support that policy, or wouldn't that just be a good solution right now so we can fill those vacancies so people at home now know that their family are going to get the care that they need?
Well, to be honest, one of the challenges I think we've seen in health and social care is that we've been too reliant on pulling the immigration lever to tackle the health and social care crisis instead of growing our homegrown talent and paying our homegrown talent. That's where we want to get to. Our health and social care services have always been international employers and recruiters. And by the way, I'm really grateful to those people who come to this country and give back through health and social care work. And we're lucky to recruit international talent. But as I say, we've been too reliant as a country on pulling the immigration lever. And that's why we've seen actually depression in pay, because the attitude has been, we'll get some people in from abroad and we'll pay them poverty pay. That's actually, I don't think, the right future for the country. Yeah. And it's not fair on people in this country who might want a great career in health, in the NHS or in social care, but either don't have the opportunities or the skills and training, or look at some of the wages and think, actually, I'll go and work at Aldi or Asda because they pay more and it's less stressful. Those are the challenges we've got to address. And believe me, I'm determined to tackle them. I won't be waiting till 2028 to do that. But I just say to people who've said, well, why haven't you done it already? It's only been 6 months. The country was in a massive hole. We are trying to get the country out of that massive hole. It is going to take some time. Bear with us. And we know ultimately we're going to be judged on results. And by the next election, I need to be able to come on your programme and say to your viewers, this country is in a better place now than when we found it after the general election. Okay. I'm confident we'll get there. Just give us a bit of time, give us the benefit of the doubt, and do support this independent cross-party commission, because I genuinely think it will deliver better politics to deliver the national care service our country needs.
Listen, your people will be telling us off for keeping you so long, but it was you that was chatting to us, so it's lovely to talk to you.
That's all right. Yeah, it's my fault for gabbing on.
No, all right. Good to speak to you this morning, Health Secretary.